In your morning medical news, older adults who experience a fall face a higher risk of dementia within a year. That's according to a new study. Researchers from Brigham and Women's Hospital in Massachusetts say the increased risk is 21%. They add the link between falls and dementia appears to be a two-way street, with cognitive decline increasing the likelihood of falls and the trauma of the falls accelerating the progression of dementia. Louisiana's new law now classifies key abortion medications as controlled dangerous substances. The drugs mifepristone and misoprostol are also used for miscarriage care and to stop postpartum bleeding. Under the law, misoprostol must be stored in locked boxes like other controlled substances. Doctors worry this could delay critical treatment in hospital emergencies. This first of its kind law in the U.S. is raising concerns about women's health care access. And new research finds combining time-restricted eating with standard nutrition counseling results in greater blood sugar control and fat loss than nutrition counseling alone. Researchers looked at people with metabolic syndrome. They found the group whose eating was restricted to an 8 to 10 hour daily window not only lost more weight, but a higher proportion of the weight loss was from fat, suggesting the intervention likely poses a lower risk of muscle loss. Behind cancers of the skin, it is the most common cancer in U.S. women. The American Cancer Society estimates more than 310,000 women will be diagnosed with breast cancer this year. But a new report finds the number of women dying from the disease has dropped substantially over the past 35 years. Mandy Gaither has a look at the new data.
It's good news, but also bad. First, a new American Cancer Society report reveals overall breast cancer death rates have plummeted 44% in the past 35 years.
Which is really a dramatic decrease. And we think that's, over 500,000 breast cancer deaths have been averted, which is really spectacular.
But researchers also discovered an upward trend in breast cancer incidence, with the steepest increase in women younger than 50, rising by 1% each year between 2012 and 2021. And Asian American and Pacific Islander women of any age increasing in that time by up to 2.7% a year. The report also says that while more white women are diagnosed with breast cancer, more black women die from it, especially young black women.
So if you're a black woman between the ages of 20 and 29, you're really 2 times more likely to die of breast cancer than your white classmate or your white colleague.
Dr. William Dayhut believes screenings and new treatments have led to the overall breast cancer death rate drop, but he says closing the disparity gaps for all women will take more research.
What is driving the cancer risk, whether it's obesity, changes in childbearing habits, or really whether it's a lot of it may be driven to really access to the right kind of care.
In an effort to address those ongoing cancer disparities, the American Cancer Society launched a study called Voices of Black Women. That is aimed at researching younger black women in the U.S. who have not been diagnosed with cancer to try to better understand their risk and cancer outcomes. Anyone interested can visit their website, voices.cancer.org.